The surgeon is going to be making an incision there anyway. 1 incision, 2 procedures. Number 1, before you have your cheek implant surgery, also known as maloplasty, establish with your surgeon what effect you hope to achieve with your cheek implant. For instance, they could be to volumise the mid-face area just below the eyes, or to enhance the outer contour of your cheekbones, or both. Number 2, before you have your cheek implants done, check the level of asymmetry between your cheekbones. There's very likely to be at least slight asymmetry between your cheekbones, because that's what most people's faces are like. Slight asymmetry isn't a problem, and your surgeon will try to even out the asymmetry when he or she does your cheek implants. Point number 3, cheek implants are often fitted through the mouth, and the necessary incisions that are made are sutured with dissolvable stitches. Now, those are in no way uncomfortable or painful. They take a few days to disintegrate, but they're not a problem. They just feel a little bit funny. Number 4, relating to the mouth, cheek implants are porous. If they're being fitted through your mouth, which is loaded with bacteria, then there is a really high risk of infections. And sadly, most antibiotics don't actually work on those sorts of infections. The only way to deal with an infection coming from cheek implant surgery is to remove the cheek implant and then to treat the infection. You can then have your cheek implant redone 6 months after, but you need to question whether or not you want to run the risk of getting an infection again. Number 5, cheek implants can also be fitted during the course of a facelift if you're having this part of your face lifted, the part just below your eyes, because the surgeon is going to be making an incision there anyway to lift your skin, and he or she will just use that same incision to fit your cheek implant. So 1 incision, 2 procedures. In case you don't know, I'm Gina. When I made this video, I was 46 and my cosmetic surgery journey was ongoing. If you're enjoying this video, then do give it a like, and also please subscribe to my channel if you haven't already done so. Point number 6, ask your surgeon what material your cheek implants will be made of. It's usually silicone, but just check, you never know. If it is something other than silicone though, as you know, you will need to ask your surgeon some follow-up questions. I think you can work out which. Point number 7, when we have implants fitted into our body, scar tissue forms all around the implant, which is fine. That only becomes a problem if the scar tissue thickens, and that's known as capsular contracture, and the problem is that it makes the implants feel hard. Now, with cheek implants, that actually doesn't matter, because as you know, cheekbones are meant to be hard. It's a very different story to having capsular contracture develop in breast implants. Point number 8, like most other facial cosmetic surgery, cheek implants involve little to no pain. However, for up to about 2 weeks after your cheek implant surgery, you might find that your cheeks feel stiff and numb, and also you might find it difficult to do things like talk, yawn and smile. You may also struggle to brush your teeth properly for the first 2 weeks post-op. Point number 9, for up to about 2 weeks after your cheek implant surgery, you should drink through a straw, and you should only eat foods that require minimal chewing. Point number 10, after cheek implant surgery, it's important not to put any pressure on the cheeks. For instance, by resting your face in your hands when you're reading or watching TV or doing anything, because that might dislodge the implant, and the only solution for that is another round of surgery. And that's a piece of advice that we have to follow forever, not just straight after surgery. In my opinion though, it's a very easy piece of advice to follow. Point number 11, related to the previous point, malpositioning of the implant, where the implant comes out of place, could be caused by something other than resting your face in your hands and putting pressure on your cheeks in that way. Like if somebody gives you a wallop in the cheeks, that will probably do it. And there could be other reasons as well. And again, the only solution is to have another round of surgery. Point number 12, as we age, our facial tissues grow thinner, and because of that, the outline of our cheek implant might actually show through the skin. What we're not recommended to do though is to just have our cheek implants removed, because that's likely to leave a conspicuous indentation in our cheeks just because the cheek implants will have lived there for so long. There are 3 remedies that I'm aware of. Number 1, synthetic filler can be applied to the margin of the implant to soften their edges so that they don't show through the skin. Number 2, you would need surgery to have the implants trimmed, and that would stop them showing through the skin. you. Number 3, if you're going to be having a facelift, then in the process of the facelift, the tissues of our face can actually be thickened. That's another solution that will prevent the outline of our cheek implants showing through our skin. Number 13, dermal fillers are an alternative method for enhancing our cheekbones. Fillers can be used to volumize our mid-face, just below the eye, volumize and enhance the outer contour of our cheekbones. As you know, over time, if you're going to be doing that continuously, fillers will end up costing a lot more than cheek implants. However, you might just not care. Number 14, a fat transfer is another way to enhance our cheekbones. Again, whether it's the mid-face, just below the eyes, or the outer contour. Now, speaking of facial implants, you may be considering beautifying your chin with a chin implant. And in this video, I tell you what I wish someone had told me before I had my chin implant. I'll see you there.